Hi there, I'm Dr. Ellen Bierhorst. I'm a clinical psychologist doing psychotherapy here in Cincinnati for over 30 years. I'm going to teach you a self-hypnosis technique for pain reduction. It's called the glove anesthesia technique. What we're going to be doing is, through imagery, imagination, anesthetizing the tips of the fingers and then the half of the fingers and then all of the fingers of one hand and then all of the palm of one hand and then the whole hand. And then we're going to place that hand with its load of anesthesia effect on the part of your body that hurts. So I'm going to pretend, for the purposes of this, that I have a pain in a tooth here in my face. And it's driving me nuts. Let's say on a scale of 0 to 10, this pain is really bad. It's an 8. A pain of 6 I can live with for short periods of time, a few minutes, before it becomes, ooh. But a pain of 8 is pretty terrible. So let's just imagine I've got a real owie here. I'm going to anesthetize my whole hand, and then I'm going to place my hand on my face where the pain is. And the anesthetic effect is going to drain out of my hand into my face and take down the pain. And I'm always going to take this attitude. I've got a pain that's an 8. I'd be really grateful if it only dropped to 7, just a little bit. So any amount of diminution will be really great, and I'll be grateful. So I'm setting myself up in that way. In actual fact, I have found that this technique enables me to reduce pain all the way. I can move something that's an 8 all the way down to a 1. And your experience will be your experience, whatever it is. So, imagine that you have a bucket, like a painter's plastic bucket that holds about a gallon. And this bucket contains a solution of anesthesia that's extremely powerful. Maybe it's an anesthesia that hasn't even been invented yet. This is a 22nd century contact anesthesia. And let's say that it is a pale aquamarine blue, blue-green, right? And that it's been in the freezer. It's really cold. It's still liquid, though, because it's a strange chemical, and it smells. It has that funny smell that it has. And I'm going to imagine that it is sitting over here next to my chair in a location where I can dangle my relaxed arm fully extended, and just the tips of my fingers can dabble in the surface of the anesthetic solution. So I'm waving my fingers. I'm actually moving my real physical fingers in this way. I'm using my left hand. But I'm moving my fingers just like this and pretending, imagining that they are dangling in, the tips of my fingers are dangling in this anesthetic solution, and as I wave my fingers in the solution, it seeps into my fingertips and makes little dabbling noises. I can hear it go plip-plop. And I can smell it. And if I look over here, I can see that there's a little vapor, almost like steam, coming up out of that. And it really feels cold. And the tips of my fingers are really cold. Now I'm imagining that you also, right now, are walking through this with me, that you have rated the pain from 0 to 10, given it a number. Just pick a number. And that you are now dangling your own hand and waving your fingers in your own imaginary bucket of solution. And if you've done that, you will notice that there's maybe a little odd feeling beginning to develop, let's say there is, in the tips of your fingers, and that you could even imagine that you are sensing cold, a feeling of cold in the tips of your fingers. Well, that's interesting, and that's just imagination. Well, how interesting is that? So then have your assistant jack up the bucket pedestal a little bit so that your fingers are halfway submerged in this anesthetic solution. So now not just your fingertips, but also half the length of your fingers, ooh yeah, is submerged in there. I said that because as I do this, and I'm continuing to wave my fingers like this, my fingers are feeling strange, definitely odd. And I feel a little chilly because I'm imagining that the darn solution is so cold. Okay. I need to make up a name for this solution. Okay, now, my fingers are definitely half anesthetized, and I'm going to raise up the bucket a little more so that the full length of my fingers can dangle in the solution, in the liquid. And I'm continuing to move and stir through the solution with my fingers so that, yeah, the maximum surface contact is achieved with this chemical. And my fingers are definitely getting changed in the way they feel to me. They feel cold, and they feel odd and different. So I'm going to call that odd differentness, well, that's the effect of the anesthesia. And if someone were to scratch with a pin down my hand and down one finger, I would feel it on my hand, but I wouldn't feel it on the fingers because it's numb and insensitive. It's numb, cold, and insensitive. Now I'm going to jack up the bucket. When you're doing this, if you're not ready, because your fingers really aren't fully anesthetized yet, pause the video and wait until they are. Wait until the full length of your fingers. You can definitely say, yeah, feels different. My fingers feel different. My fingers of the dangling hand feel different from my other hand, and they feel cold and insensitive. And I can imagine that they are anesthetized. All right, now I'm going to jack up the bucket some more so that it's higher, and my fully extended arm and hand are, it's submerged halfway up my palm. maybe to the point where my thumb separates from the rest of my hand. That deep. And I'm going to continue to wave my hand in the fluid. Just continue to wave the hand. So you may notice feelings of chilliness developing in other parts of your body. I know that I do. I don't like to be chilly, but I'll do anything for pain relief. And I'm feeling chilly in my other hand, and I'm feeling chilly in my chest a little bit. My toes are chilly. Anyway, I'm continuing to, oh yes, I can now say that half of my hand is altered. It feels different, changed. Okay, so I'm going to crank up the bucket to be a little higher so that the full hand, all the way up to the glove line, is anesthetized. Oh yeah, I'm feeling it in the palm of my hand. I'm continuing to stir. I'm continuing to imagine the sort of pale aquamarine blue-green color of this fluid and imagining the smell of it. Kind of pungent. Okay. Now at some point here, your whole hand is going to be numb, cold, and insensitive. You'll be able to say to yourself, well, yeah, okay, I'll say it's done. It's cooked. Then you take that cold, numb hand and you put it where the pain is, right on that pain, direct contact. And you're going to imagine that the effect of the anesthesia is draining out of the hand and into the face and the gum and the tooth, whatever is there that hurts. Numbing the nerves, completely numbing everything it comes into contact. And here's a strange thing. The effect in the hand is at one level, but when it shifts and it drains into the body somewhere else, it's at a higher level. It's a little bit like a homeopathic remedy in that the more you move it, in the homeopathy example, the more you dilute it and shake it, the more powerful it gets. So the anesthesia, the power of the anesthesia in the hand was at one level, but the power of the anesthesia in my face is going to be at a higher level. Thank God. It's really so wonderful and so effective. So as I'm talking, the anesthesia is draining out of my hand into my face, out of my hand into my face. And I hope that you're walking through this with me. And I want to tell you that as you do this for yourself, it's always good to use the YouTube video to walk you through it. You don't have to look at it, just listen to it. And it will help you. Take your time. The error that we make is that we're in such a hurry to get pain relief, we don't take enough time to really get that hand numb. So you want it really numb. All right. So let's say that we're going to have almost all of the hand feeling back to normal, but a little bit of the hand is still cold, numb, and insensitive because that much anesthesia is still in the palmar surface of that hand. It's not all gone in. And we're going to take an invisible magic spatula, a rubber spatula, and scrape down the surfaces of the hand to make sure that every last little bit of anesthetic effect has been transferred into the face, so that the hand will become completely warm and normal, but the face will feel cold, numb, and insensitive. If yours is not almost there, pause the YouTube video and wait and talk to yourself and say, okay, now I can imagine that as the anesthesia drains out of my hand and into my face or into my leg or whatever part on you is your hurting part, that I'm taking my magic spatula and I'm going up and down my fingers with it and shoving it. Sort of, I'm imagining like I'm icing a cake and I'm shoving the material around with my spatula and massaging it into the face. Okay, now I'm going to say, yeah, I could say that my hand is feeling normal, but my face is now feeling a little numb, cold, and insensitive. That is to say, I can imagine convincingly to myself that this part of me is now numb, cold, and insensitive. And here's a neat idea that always works. Yeah, it's getting stronger now. As time goes by, the next minutes, up to an hour, maybe sometimes more, it will continue to get stronger and stronger. So, let's rate your pain. I said my pain was an 8. What is it right now? Well, it's certainly not an 8 anymore. It's less than that. Is it a 7? Oh, no, it's less than that. It's probably less than 6. Let's say it's 5. So I'll check in with myself later and see just how much it drops. If you have multiple pain sites, you can do this multiple times. You can do it over and over again. There's no overdose on this thing. The only error you can make is to rush through it, and then it's not all that effective. So take your time. This is now 18 minutes long. Good luck with that. I'm in Cincinnati. www.lloydhouse.com is my website. Lloyd is spelled with 2 L's. Good luck. You can communicate with me via email.